Type 1 diabetes is much more abrupt and severe than type 2 diabetes, and it typically occurs earlier in life. Of the triggers that can lead to the diagnosis of type 1 diabetes, infection is the most common. Pregnancy or a myocardial infarction are also possible triggers. The symptoms that are associated with type 1 diabetes include fatigue, polyuria, which is increased urination, polydipsia, which is increased thirst, vision changes, weight loss, or dehydration. Type 1 diabetes is broken down into 1A and 1B. 90% of cases belong to the type 1A, or the autoimmune type, whereas the remaining 10% belong to the type 1B, or the idiopathic type. The tests that are associated with type 1A diabetes include the glutamic acid decarboxylase, or GAD65, and the islet antigen 2, or IA2 test. Patients who have type 1A diabetes, which is again the autoimmune type, they may also have other autoimmune conditions such as celiac disease, Graves' disease, hypothyroidism, Addison's disease, pernicious anemia, or vitiligo. The type 1B, or the idiopathic type, has no autoimmune markers. The patients who have type 1B usually have an Asian or an African heritage.